guys, welcome back to my channel in another video of Clinical Dentistry Hub. If you are new to my channel, please go back and click the right color subscribe button. So today's video is all about the things to be kept in mind before joining dentistry in India. What are the eligibility criteria for joining Bachelor of Dental Surgery course in India? What is basically the Bachelor of Dental Surgery course? What you have to do for the entire 4+1 year. All of these things will be covered in today's video. Please watch the video till the end so that you do not miss out any important content of my video. So my name is Dr. Shabs and you are watching Clinical Dentistry Hub. So let's just begin with the video. So the first question is, what does BDS stands for? So the BDS is Bachelor of Dental Surgery course. It is the only course that is available in India through which a person can attain a course of Bachelor of Dental Surgery degree. So for applying to the Bachelor of Dental Surgery course, one must have physics, chemistry, biology in their 12th class and 50% marks in their board examination should be there before applying to. Now everywhere the entrance examination is need, that is national eligibility cum entrance test. You have to appear for the exam, you have to clear for the exam, and that after clearing the exam, and then you have to appear for the counseling of these particular sessions. Counseling is there, then after counseling you can opt for your colleges. Now talking about the colleges, either you can go to the private college or government college. The only difference between the private and the government college is, first difference is fees. In the government college the fees will be 1 to 6 lakh per annum, or in any private college it will be 6 to 7 lakh per annum if in a good college. But there are few colleges which are good but their fees is also low, that is 2 lakh per year the fees will start in a private colleges like this. Plus the thing that is you have to keep in mind is that you have to see the facility and the faculty. Like you know that if you will go in this college, just go there, talk to the student, talk what facilities they are getting, talk to them that how are the faculty over there. And the second thing, that is the exposure. First is facility and faculty, second is exposure. So you have to see the exposure over there. The number of patient in the government college, you have a much exposure of the patient, whereas in the private college the exposure of patient is bit less. But there are many private college where the exposure of patient is much greater than the government college. So not to worry about it. If you are getting a private college, you can afford the fees, just go for it. And one thing is that never consider dentistry as a backup option. This I am saying because many of the parents, they teach this style that for the entire year you have prepared for the MBBS examination and you are not getting MBBS seats. Just go and opt for Bachelor of Dental Surgery course because you will get there the title of a doctor. So this is totally wrong. Please do not teach these things to your student. Why I am saying so? Because if you are teaching that if you are not getting MBBS, go and opt for BDS, I must tell you that BDS is not totally based on a knowledge like MBBS. Beside having a knowledge, one should have a good practical hand also, the artistic work also, because beside knowledge you have to perform patient work also. For that you need a good practical hand. So all of these has to be kept in mind before you are taking admission in MDS. Don't ever think like that, we'll go there, we'll just pass the exam and it is done. No, the clinical work is must to be done over there. For that you need a lot of practice. Knowledge will work there. Knowledge you will have to have a knowledge about performing each and every procedure. Without having knowledge is like you are building a building without having a foundation. Without having a base, you kept on build a building, it will fall down one day. So without having knowledge, if you treat like patient, you will fail one day. I am not demotivating you, I am just telling the inside fact of the dental surgery course. So now after you have entered in your dental surgery course, the expenses has to be kept in mind. Earlier I also used to think that MBBS will have a lot of expense, BDS will have a generally less expense, but when I entered, there are a lot of instrument, lot of material that you have to buy and will cost you around 30-40,000 for all of these 4 years. So you have to have thousands of rupees saved with you so that you can buy the latest equipment with you and latest materials, so that you can learn on the different techniques and different material. But remember that buying these instrument and material depending upon in which college you have taken admission. Like there are many college, they'll provide you with everything, you do not need to buy, but there are some college where you need to buy all of these things. That has to be kept in mind. Though finance is always the back part of taking admission anywhere. After this, when you have entered, then for the first year you will study all the dental subject plus medical subject. In the second year also dental subject, medical subject. In the third year also dental subject and medical subject. Whereas in the fourth year entirely dental subject will be there. So for the first 3 years dental and medical both, and for the fourth year the all 8 dental subject will be there. So these all 4 year plus 1 year internship. In the internship you will be posted in the respective department for 1 month or for 45 days. You have to complete your compulsory rotary internship, then only you will get your Bachelor of Dental Surgery degree. So after these completing internship, then all of these in the fourth year, third year, from the third year you will start getting patient. From the third year you will take patient case history, you will prepare model for them. Then after radiographic examination you will get to learn that. Intraoral periapical radiograph you will start taking. Then in the fourth year you will start performing procedures on the patient like restoration, extractions and all. The thing that is to be kept in mind, how you will manage your quota and study together, because there are certain times if you are doing a complete denture patient, you are doing the patient, your posting timing is not that much, only 2 to 3 hours will be there in your posting. And after performing your posting work, like for example you are having a CD patient and you are just taking the border molding of upper and lower, you have to do it in a day. So for a fresh BDS it is very tough to do upper and lower border molding in a single day, and time is also very less. And next you have your theory subject which you have to attend class over there. So there are certain times you will be missing your theory subject. You will get a scolding from these teachers also for missing the subject. First of all, they don't allow to miss the lectures and work in the clinic. You have to finish your work in the clinic also. These problems you can face over there. So you have to keep a balance between completing your quota work and then completing your theoretical subject. By the time you reach your home or hostel, you will be so much tired that you will not be wanting to study, but you have to force yourself to study, so that at the end of the examination time you do not have a lot of burden over your head, because in the fourth year in the exam you have to perform their patient work clinically over there in the front of the examiner. So before pursuing dentistry, please keep all of these things in your mind, that what are the basic thing, what are the basic perspective of you pursuing this Bachelor of Dental Surgery course. So this is all about it. If you have any problem, you can just put it down in the comment section. And yes, of course, don't forget to like, share and subscribe. I'm signing it off. Bye bye. Take care.